Hey everyone, Azim here. We are wrapping up Chapter 6, Cartilage and Bone, Cartilage and Osseous Tissue, as a precursor to when we finally talk about the names of bones and where they're located. Here we're going to talk about landmarks on bones, all the different little pieces of single bone and what these little things are named, how we can identify different bones, and basics of bone shape. Now, when we look at a bone, when you look at a textbook, you'll see that there's tons of different names, so many different names of different parts. This round thing has a name, this protrusion has a name, this protrusion has a name, this ridge has a name, this inner portion has a name. Every single little piece of bone has a name, and it can get very tiring. There's a reason for why they're not all named something. Just like this bar tool, if you have it in your set, has names. I don't think I know every single name, but let's see if I can name them all. Well, at least for this part, this is the handle, right? That's where you hold it. You hold it there so that you can open up different bottles. If you need a bottle opener, you have that. If you need to open a wine bottle, you have a corkscrew. You have a knife here to cut the label open, cut the top of a wine bottle open. This is to help you push down on the wine bottle when you're pushing up. I really don't know the name of that thing, but every single part has a name, I'm sure it does, and every single part has a function. Once again, this is an anatomy class. Structure relates to function. Every single thing is made for a reason. So the anatomy of this bar tool is to open up different things in very specific ways. The anatomy of all of these little protrusions and indents and holes, they're there for a reason. So we're going to learn not every single name of every single bone feature, but a lot of them as we go through the different bones of the body. Before we get to that, we need to understand the different shapes of bones. So let's go over the different shapes. First is a long bone. A long bone, you can see the clavicle here, humerus, radius and ulna, the phalanges, the femur, tibia, fibula, and the phalanges of the feet. If you don't know those names yet, we're going to go over them next time. But all these bones are considered long because they're longer than they are wide, and they're fairly cylindrical. These bones are adapted for mobility and reaching and attachment of muscles. They're on our limbs, so they help us move around, have leverage. By being long, they can do that. Remember, these long bones form from endochondral ossification. So they're not fully bone until adulthood. These have that epiphyseal plate that's still hyaline cartilage until adulthood, until full maturation. If I draw a small sketch here on the side, I'm drawing a long bone. Close enough, I guess. What's here in blue? We're going to call that compact. Let's do spongy bone in pink. Spongy bone is found towards the ends in the epiphyses and then lining the medullary cavity. But what I mean to bring up here is that there is a medullary cavity. Not every bone has that. There's this wide open cavity for the yellow bone marrow. I don't like my G. Close enough. Okay, there's a long bone. Adapted for reaching, mobility, and attachment of muscles. Compact bone on the outside, spongy bone more towards the epiphyses, and also lining where the medullary cavity would be. Small bones are found in very specific places. Small bones are found in your wrists, your wrists, in other words, your carpal bones, and also your ankles, your tarsal bones. So if I draw a not to scale picture of a small bone, we have compact bone towards the edges, and then spongy bone on the inside. So there's no medullary cavity. There is space for red marrow in between the spongy bone, but there's no medullary cavity. By being small, you can have a gliding motion. These are found in areas where you have a high degree of motion, your wrists and your ankles, your carpal region and your tarsal region. High mobility areas. That's the advantage of the small bone. Flat bones, as we've mentioned, flat bones are found in your skull. They're found in your scapula. So your cranium, occipital, parietal, frontal, nasolacrimal, vomer. We'll go over all those bones later, but they're all in your head area. Your sternum, your ribs, your scapulae, your shoulder blade, your ilium. Your ilium is this part of your coxal bone. It's flat. What all these have in common is that they're very protective. And they have lots of surface area for muscle attachment. So that's especially true for the scapula. Flat bones are, because they're so wide, have a lot of space in between their spongy bones. So there's a lot of space for red bone marrow. In fact, if you ever give bone marrow, or if you donate bone marrow for a bone marrow transplant, what's pictured down here, what's pictured down here is a health professional using a very large needle, injecting it into the ilium, the flat bone of your hip, and going through and taking that rich bone marrow so that you can provide healthy blood cells for someone. If I were to draw like a cross section, longitudinal section really, make a longitudinal section of a flat bone. Did I say this already? Flat bones come from intramembranous ossification, because you want that immediate protection of vital organs. So let's say this is a longitudinal section of a flat bone. Compact bone is on the outside. Spongy bone is in the middle, sandwiched in the middle. When I say flat, it doesn't have to be perfectly flat. There can be curvature to the bone, just like this one here in the skull, but overall it's got nice, large, flat surface. Now we're getting to some really specialized bones. Pictured here, this is the back of a skull. If you feel like this bump on the back of your head, that's this. This is the bump on the back of your head. It's called the external occipital protuberance. Anyways, here is one bone. Let me draw the outline of one bone. That's one bone. That's your occipital bone. It's a flat bone. Here's another bone. That's called the parietal bone. Here's your right parietal bone. 3 bones right there. Flat bone, flat bone, flat bone. These flat bones form from intramembranous ossification. Because of that, because they're kind of merging eventually, they don't fuse together, but they eventually come and border each other. Sometimes you'll get an island of bone that's smaller than the rest, and it's just kind of in between everything. That's what this bone is. That bone is called a sutural bone because it's between those flat bones. The joint between those flat bones is called a suture. These sutural bones are just to fill in the gaps, basically. They can vary from person to person. So it's hard for me to, let's see how I can do this. If I draw a flat bone here, flat bone here, flat bone here, but then in between, we have our funny shaped sutural bone. Sutural bones fill in the gaps that are only found in your skull, only found in your cranium. A suture, once again, is the fibrous ligaments that are in between the flat bones. Something that we're going to go over in the next chapter. Here's an even more specialized bone. Some bones only found in your skull, in your face, and in your face. Some bones have air-filled spaces. Think of them as caves. If you were to wander into a cave, you're in the outside world, you walk into the cave, and now you're still connected to the outside world, but you're deep within rock structures and other kinds of earth. I don't really know, I'm not a geologist, but you're inside of the space. You're inside of the space. The term for this is pneumatized. P-N-E-U is silent. P-N-E-U means air in Greek, I believe. Pneumatized means it's this air-filled space within a bone. So it's not like a medullary cavity where it's just kind of hollowed out. This is where your bones have carved this cavernous space. It's a cave system, basically. The benefit is that we're reducing the mass of our head, and it's more surface area for mucous membrane. It's lined with pseudostratified columnar epithelium, and it has cilia, just like our trachea. This is part of our respiratory system. These sinuses, did I write the word sinus? There we go. These are collectively known as your paranasal sinuses, these air-filled spaces in your bone. And there are only 4 bones that have these air-filled spaces, these pneumatized bones. Those are your frontal bones. You have one frontal bone. Your sphenoid is posterior to that, or ethmoid is posterior to that. Sphenoid is posterior to that. And then maxillae are the upper jawbone. We'll go over these bone names later. If you don't know what they are, don't worry about it. We'll get to it. But they're connected to your nasal cavity. When you breathe air in, air can swirl not only down to your larynx, trachea, and lungs, but it can also swirl around in these sinuses so that you can filter, you can humidify, you can heat up air. We're increasing surface area to maximize filtration, humidifying air, and warming it up. So I'm going to attempt to draw a pneumatized bone. All right, so that's some bone, but got like spaces, kinda, and then a light amount of spongy bone. I want to point out that the frontal bone is both flat and pneumatized. The main part of it is flat, but part of it is also pneumatized as well. You can cross, in some cases, you can cross shape categories. A sesamoid bone is a sesame seed shaped bone. Oid is the Greek or Latin for ish. It's sesame-ish. It's small, it's round, it's smooth. Your largest sesamoid bone is your patella. There are other tiny ones in your wrist, in your big toe, in your phalanges. We're not going to go over them because they're so small. But your largest, most prominent sesamoid bone is your patella. By being small, round, and smooth, your tendons can glide over them very easily. If you take a look down here, imagine that there's a tendon and a muscle right here that can cause movement of this lower leg, can kick your leg up and down, can glide over this smooth patella. It acts as a pulley. Same would be true for your phalanges, your wrist, for your toe. So sesamoid are a specialized type of bone. Let's draw it as rounded on one side at the very least. Oops, I can use the blue as the compact bone. And then towards the middle, we've got our spongy bone. Irregular bones, sorry, I'm covering up part of my text here, but irregular bones develop in multiple pieces. So they have a mix. What this says here, there's a mix of endochondral and intramembranous ossification. Pictured here is a developed vertebra, where I just circled in pink. Pictured here is a developed vertebra. To get this shape, it had to come together in pieces. We first ossify parts of it, and then ossify some more parts of it to put it all together. So initially, these initial parts may have been from intramembranous ossification, and then the new parts form from endochondral ossification. It's a combination of both types of ossification to form this very irregular, specific shape. Most of these bones, or all of these bones, these irregularly shaped bones, are in the skull in your face, your vertebrae, your sacrum and coccyx, and the rest of your coxal bones, the ischium and pubis. So they're all found in this axial line. I have a full list here. We'll go over the names later. But these are specialized bones because you have a bunch of holes in your face. You have your vertebrae protecting your spinal cord and needs that big hole, as well as holes on the side for nerves, and your coccyx, or sacrum and coccyx also for holes for nerves, and then the ischium and pubic bone, holes for nerves, blood vessels, and providing a lot of support. So they have very specialized needs, just like pneumatized and sesamoid. One more time, I will attempt to draw this bone here on the side. Let's see. Draw it in pieces. If you were to cut into it, you would see spongy bone in the middle portions. So those are our 1, 2, 3, 4, 5, 6, 7 bone shape types. If any bones are more than one type, it's usually flat and pneumatized or irregular pneumatized. So pneumatized is where it can kind of double up on bone shape. Now, talking about bone features. So here we're discussing bone features, or I might call them bone characteristics. Characteristics. Parts of a bone that have names. And there are a lot of funny names out there. So it's going to take some getting used to. We will get practice. So I don't expect you to memorize every single term you see here quite yet. We will get there. For now, I want you to pay attention to these words at the top. Our first bone feature type is an articulation. The word articulation is where two bones, at least two bones meet, sometimes three. An articulation is where bones meet each other. You might know about articulations where we have lots of movement. We also have articulations where there's not a lot of movement, like between our flat bones of the skull. Either way, it's an articulation. And there's names for these regions of bone that meet at these places. For example, at the base of our skull, so this was an inferior view of our skull, we've got these flat yet rounded portions. This is called a condyle. Or maybe you've got a flat part that meets with another bone. This is a facet of the vertebra that meets up with the rib. If we're looking at this large leg bone, the femur, you can see that there's this really prominent head. And when you have a head, you usually have a neck portion of the bone. It has to stick out so they can fit in a socket and also so our leg can move around. So those are just some examples of articulations where two bones meet. Condyles, facets, heads, and necks are examples of articulations. Our second bone feature, bone characteristic type, is an extension and projection. Now this is very broad, and you can see how many terms here, and I don't think this is a complete list either, how many terms fit under extension or projection. Any little protrusion, little or big protrusion coming off of bone is an extension or projection. Sometimes they do articulate. Sometimes they don't. Oftentimes they're for muscle attachment. Take a look at this. This is our arm bone. This is the humerus, what I just circled down here. Do you see this little protrusion right here? This little bump? That's called a tuberosity. A tuberosity is a rough elevated surface. That is an attachment point for a muscle. So a tendon will attach at that point. Or if you take a look at this coxal bone here, we can see this long ridge here. This is known as a crest. A crest is a narrow ridge, attachment for muscles. Or down here, we have protrusions on either side. Those protrusions are epicondyles. They're protrusions superior to condyles. There's a lot of these different terms. I'm not going to go through each one right now, but we're going to get used to them. Those are some examples, and what they do is that they either articulate with bones or they serve as muscle attachment points. If we're going to move our bones, muscles have to attach to something. These projections allow a good attachment point. Third type of bone feature, bone characteristic is a depression. Depression in this context means a part of bone that goes a little bit in. It's either shallow or it could even be deep. An example of a deep depression, physical depression, is an alveolus. Do you see these sockets in where if you pull your teeth out, you're left with a socket. That socket is an alveolus. If you feel this flat part of your head, or if you were to cut your head open, remove your brain, and you have that hollow portion of your skull, that's a fossa. A fossa is a broad, longer, shallower space. You can see another one right here. Here's a fossa. A fovea is a tiny pit, not tiny, small enough. So here at the end of this bone, there's a hole right here. Not a hole, sorry. It's a pit. It's kind of like dug out a little bit. It's a shallow, small, circular area. This is an area for a ligament to attach. And then if we have a long line, that's shallow. If we have a long groove, maybe to hold a tendon or a nerve or a blood vessel to fit in the part of the bone, that's called a sulcus. The word sulcus means a groove. These are all examples of depressions, and depressions are places for muscles or attachments, like these ones for nerves and tendons and blood vessels. They're fitting in those spaces. Like this fossa right here, we're fitting in a muscle. This fossa right here is actually an articulation. So sometimes it can be an articulation. Depressions, shallow, for muscle attachment, ligament attachment, nerve, blood vessel space. Or protection. Finally, our fourth type of bone, characteristic bone feature type, is a passage. A passage is a literal hole in the bone. I'm not talking about pneumatized bone. Well, actually, I am. Sorry. Pneumatized bone has passages. Remember sinuses? Air-filled spaces in bone. That's an example of a passage. See this big hole at the base of our skull for our brain to meet up with our spinal cord? That hole is a foramen. It's pronounced foramen. Foramen. Heads up, plural of foramen is foramina. It's a weird one. Plural of foramen is foramina. So that's another example of a hole. We can have canals like your ear canal, or more accurately, your acoustic canal, or acoustic foramen, or meatus. Or let's go with the intervertebral canal, the canal for having nerves pass in between your vertebrae. That's an intervertebral canal. A meatus, this is another funny sounding word, meatus. A meatus is another passageway. It's like a canal. It's an opening into a canal. They're very, very similar. So the ear canal is also known as the acoustic meatus, the hole for sound to go through. Acoustic is referring to sound, meatus is the hole, the passageway. And then a fissure. A fissure is a longer crack, a slit. Let me skip ahead and show you an example of a fissure. Here we go. In this anterior view, we can see this long fissure here. This is so nerves can pass to and from the front of the face. This eye area, this ophthalmic area, this orbital area. So fissures are longer. The rest of them are rounder. Well, except sinuses, those are cavernous. Let me recap that one more time. Canals, foramina, and meatuses, meati, all these are very round. Some are big round, some are smaller round, but they're round. There's a ton of holes in the base of your skull. We'll be getting to those later. Fissures are longer. Sinuses are cavernous. And we're going to see how nerves, blood vessels, air can pass through these different areas of our bone. I provided more pictures here for you to see examples of each type. I'm not going to go through each one right now. We're going to go through this in lab. But please feel free to pause and take a look at these examples. We have all kind, every bone doesn't necessarily have every single bone feature type, but they tend to have many. Like you can see this sacrum has passages, has articulations. This is kind of a fossa. There's many different components of a given bone. So once again, just like a specialized tool, like this bar tool, our bones are highly specialized. All these little passages, depressions, extensions, projections, articulations to help it do its job. And by being long or small or pneumatized or flat or sesamoid or irregular, pretty sure I'm missing one, sutural. By being one of those bone types, it helps it do its function, whether it's just protecting or providing length and leverage. It'll help you do something important for your survival. All right, that's chapter 6. Next chapter, we're going to go straight into bones and learn all the different names of bones and what they do. So look out for that. Thank you, everyone. Please leave questions, comments in the comments. in the discussion. Yeah, hope to talk to you later.